In this video, let us understand about the internal organs. So, the pelvic organs. We are talking about the pelvic area, that means this area. You can see the whole human skeleton, and in that the area between your two legs, that is the pelvic cavity or the pelvic area, which we will be discussing. So, this is the pelvic cavity, or you can say the place where your pelvic organs lie. This is the pubic symphysis, that is the front portion, and this is the spine, that is the back. So, in between the pubic symphysis and the spine, we have the pelvic cavity, and in that pelvic cavity we have pelvic organs. So, let us see the pelvic organs. So, basically in the side view, when you see the side section of a female body, so this is the spine, so this is the spine, and this is the tummy, so the tummy, and this are the pelvic organs. You can see the pelvic organs in this image again. So, the symphysis pubis or the front bone, the backbone or the sacrum and the coccyx, and inside this, from the front to the back, we have these organs. So, the first organ is the urinary bladder or the small pouch where the urine is collected. After this comes the uterus or your womb where the baby grows, and behind that comes the rectum, the last part of the intestine. So, let us see the first organ first. The urinary bladder. When we talk about the urinary bladder, that is a small pouch where urine is stored or collected, and this urinary bladder is a part of the renal system. That means the system where the urine is formed. So, above, as you can see here, above it is connected, this is the kidney, and the right kidney and the left kidney. Both these kidneys will filter the blood, the urine will be formed, and this urine will come down through these tubes known as the ureter, and the ureter is connected with the bladder, the urinary bladder. So, the kidneys, they have the ureter and they connect with the bladder. So, your urine comes, so your urine is formed in your kidneys, travels through the ureter and gets stored into the bladder. So, this is the small triangular structure called the bladder, and this is how the bladder looks from inside. So, you can see the inside of the bladder. If we zoom a bit in, you can see there are two holes and the third hole is here. So, this is where your ureters are connected, and this is the P canal, or you can say the urethra. So, your bladder internally has multiple sac, or you can say small pouches. Like this is the structure. We are not going in detail of all these structures, but just for the understanding, there are two openings above which are connected through the ureters to the kidney, and one opening below, that is the urethra or the P canal, and this urethra is supported by your vaginal muscles, that are your pelvic floor muscles. So, the weak or the loose pelvic floor muscles do not provide a good support to your urethra and can cause issues with urine leakage. Also, if your vaginal muscles, that are your pelvic floor muscles, are spasmodic or painful, they might not relax and might give pain during urination. So, you can see the urinary bladder here again, and as we discussed, you can see one hole. This is a cut section. That means you have cut the whole structure into two parts. So, this is the one opening of the ureter and this is the cut section of the urethra, and this is how your vaginal muscles or pelvic floor muscles are located. So, they squeeze or they work for the control of the urethra.